Lecture Script, Part 1. Oral Health, Microbiome, and Systemic Disease. The Missing Link in Modern Medicine. Good morning, friends. Today, I would like to discuss something that is extremely common, frequently ignored, yet profoundly important: oral health. Not as a dental issue, not as a cosmetic concern, but as a central regulator of systemic health. Because if we truly understand what is happening in the mouth, we begin to understand what is happening in the entire body. 1. The central premise. Let me begin with a simple but powerful statement. The mouth is not separate from the body. It is the most active interface between the external environment and systemic physiology. Every day, we eat through the mouth. We breathe through the mouth. We introduce microbes through the mouth. And yet, in clinical practice, the mouth is often excluded from systemic thinking. This is the gap we are addressing today. 2. Why oral health is neglected. Before we go deeper, we must ask an important question. Why is oral health so commonly neglected by patients and even by physicians? There are several reasons. First, lack of symptoms. Most oral diseases, especially periodontal disease, are slow, silent, non-painful. Patients may have bleeding gums, bad breath, mild discomfort, but they rarely experience urgency, so they ignore it. Second, lack of awareness. Many people believe it is just bad breath. It will go away. In fact, most individuals with halitosis are not aware of it themselves. It is often noticed only by others, and even then, rarely communicated. Third, medical siloing. Dentistry and medicine function separately. Physicians are trained to look at blood pressure, sugar, lipids, but not gums, tongue, oral microbiome. So, oral health remains outside the diagnostic framework. Fourth, time constraints and protocol-based care. Modern practice focuses on measurable parameters, not upstream drivers. As a result, oral inflammation is ignored. Root causes are missed. 3. The oral microbiome, the first ecosystem. Now let us understand the biology. The oral cavity is home to over 700 species of microorganisms. This is not contamination. This is an ecosystem. In a healthy state, these microbes exist in balance. They support immune regulation, nitric oxide production, barrier integrity. But when this balance is disturbed, we enter a state called dysbiosis. This is the starting point of disease. 4. What causes oral dysbiosis? Several modern lifestyle factors contribute. Frequent sugar intake, continuous snacking, processed foods, poor oral hygiene, mouth breathing, chronic stress, overuse of antiseptics, antibiotics. These factors shift the environment. Lower pH, reduced oxygen, increased inflammation, and this favors pathogenic bacteria. 5. The pathogenic microbiome. In dysbiosis, certain bacteria become dominant. These are not always foreign organisms. They are opportunistic residents. Key groups include periodontal pathogens, acid-producing bacteria, protein-degrading bacteria. They produce toxins, enzymes, volatile sulfur compounds. These lead to gum inflammation, tissue destruction, bad breath, but most importantly, they initiate a systemic inflammatory process. 6. The unified pathogenesis model. Now we come to the most important part of this lecture. Despite affecting different organs, the underlying mechanism is remarkably similar. Let us walk through it step by step. Step 1. Dysbiosis. The oral microbiome shifts from symbiotic pathogenic. Step 2. Barrier breakdown. The gums become inflamed and permeable. This allows bacteria, toxins to enter the bloodstream. Even normal activities like chewing, brushing can cause repeated bacteremia. Step 3. Chronic inflammation. The immune system responds. Cytokines increase. IL-6, TNF-alpha, CRP. This creates low-grade chronic inflammation. Step 4. Endothelial dysfunction. This is a central event. Blood vessels lose flexibility, nitric oxide signaling. This leads to hypertension, atherosclerosis, poor circulation. Step 5. Oral gut axis. Every day we swallow saliva containing billions of bacteria. If the oral microbiome is unhealthy, these bacteria reach the gut, alter gut microbiome. This leads to dysbiosis, increased intestinal permeability. Step 6. Immune dysregulation. The immune system becomes overactive, poorly regulated. This can lead to autoimmune tendencies, chronic inflammation. Step 7. Systemic effects. Now, different organs express the damage differently, but the root cause remains the same. 7. Systems affected. Let us briefly summarize: cardiovascular system, hypertension, atherosclerosis, stroke, metabolic system, insulin resistance, diabetes, nervous system, cognitive decline, mood disorders, gastrointestinal system, dysbiosis, leaky gut respiratory system, infections, exacerbation of lung disease, renal system, microvascular damage, immune system, chronic inflammation, autoimmunity. Key insight: different diseases, same upstream drivers. 8. Oral microbiome and immunity. The microbiome is not passive, it actively trains the immune system, maintains tolerance, prevents overreaction. When disrupted, inflammation increases, immune balance is lost. Oral gut-brain axis. This is an important concept. Oral dysbiosis, gut dysbiosis, brain effects. This leads to neuroinflammation, mood disturbances, fatigue, also psychosocial effects. Bad breath, social withdrawal. 10. Role of diet. Diet directly shapes the oral microbiome. Harmful patterns, frequent eating, sugary foods, processed foods. These promote acidic environment, pathogenic bacteria, beneficial patterns. Meal spacing, fibrous foods, leafy greens, these support. Saliva, microbial balance, nitric oxide production. 11. Artificial sweeteners. Even non-caloric sweeteners like saccharin are not inert. They can alter gut microbiome, promote glucose intolerance. This occurs via microbiome-mediated pathways. 12. Antibiotics and microbiome damage. This is a critical issue. Broad-spectrum antibiotics destroy beneficial microbes, reduce diversity. Up to 30–50% of microbiome can be affected. Recovery: weeks to months, sometimes incomplete. This leads to dysbiosis, opportunistic infections, long-term metabolic effects. 13. Overuse of antiseptics. Frequent use of mouthwashes, sanitizers leads to reduced microbial diversity, loss of beneficial bacteria, especially nitrate-reducing bacteria, which affects nitric oxide, blood pressure. 14. Antibiotic overuse in sore throat, a major practical issue. Most sore throats are viral, self-limiting. Yet antibiotics are commonly prescribed. This leads to no real benefit, significant harm, better approach, supportive care, warm saline gargling. 15. Antibiotic resistance. This is not just individual, it is societal. Overuse leads to EHO-resistant organisms, reduced future treatment options. 16. Loss of colonization resistance. Important concept. When good bacteria are removed, bad bacteria take over. This explains recurrent infections, fungal overgrowth. 17. Rebound, dysbiosis. After antibiotics or antiseptics, microbiome does not return to original state, may become more pathogenic. 18. Doctor-patient cycle. Patients expect quick relief. Doctors prescribe antibiotics. Cycle continues. Breaking this requires education, awareness. Closing of Part 1. Let me summarize the core message. Modern disease is not just about pathogens, it is about imbalance. And the mouth is often the starting point, the amplifier, the missed opportunity. Next, in Part 2, we will cover practical oral care protocol and clinical implementation. Lecture script, Part 2. Practical oral care as daily preventive medicine. Having understood the systemic importance of oral health, the next logical question is, what should a person actually do in daily life? Because knowledge without practical application has limited value, oral care must be simple, consistent, sustainable. It should not be complicated, but it must be correctly done and regularly practiced. Let us go step by step. Step 1. Brush teeth properly, twice daily. Brushing is the most basic and essential practice, but it is often done incorrectly. Use a soft bristled toothbrush, not a hard one. A hard brush can damage the gums and cause recession over time. The brush should be placed at approximately a 45-degree angle toward the gum line, not just on the teeth. This is important because disease begins at the junction between the teeth and gums. The brushing movement should be gentle and circular, not aggressive horizontal scrubbing. Vigorous brushing does not clean better. It only causes mechanical injury. Each session should last about 2 minutes, ensuring all surfaces, outer, inner, and chewing surfaces, are cleaned. Brushing should ideally be done twice daily, once in the morning and once at night before sleep. Night brushing is particularly important because during sleep, saliva production decreases, allowing bacteria to multiply more easily. Step 2. Clean. Between teeth, daily. Brushing alone is not sufficient because it cannot reach the spaces between teeth. Food particles and plaque accumulate in these areas, creating a favorable environment for bacterial growth and gum inflammation. Therefore, interdental cleaning is essential. This can be done using dental floss. Interdental brushes, especially useful if spaces are larger. This step should be done once daily, preferably at night. The technique should be gentle, allowing the cleaning material to reach slightly below the gum line without causing injury. This is one of the most commonly neglected steps, yet it plays a crucial role in preventing periodontal disease. Step 3. Tongue cleaning, every morning. The tongue is a major reservoir of bacteria, particularly those responsible for bad breath and microbial imbalance. A tongue scraper should be used every morning. The cleaning should be gentle, moving from the back of the tongue toward the front. This helps remove the coating that contains bacteria, food debris, and dead cells. Regular tongue cleaning reduces bacterial load, improves breath, enhances taste perception, supports microbiome balance. This is a simple but highly effective practice that is often overlooked. Step 4. Maintain adequate saliva, natural defense system. Saliva is one of the body's most important protective mechanisms in the oral cavity. It neutralizes acids, washes away food particles, contains antimicrobial substances to maintain adequate saliva. Ensure proper hydration throughout the day. Avoid chronic mouth breathing. Chew food thoroughly. Dry mouth creates an environment where harmful bacteria can thrive. Therefore, maintaining saliva flow is essential for oral and systemic health. Step 5. Rinse the mouth after meals. After eating, food particles and sugars remain in the oral cavity, feeding bacteria. A simple habit of rinsing the mouth with plain water after meals helps remove these residues and reduces bacterial activity. Additionally, warm salt water rinsing can be used occasionally, especially if there is gum inflammation. It has mild anti-inflammatory and cleansing effects without disturbing the microbiome. Routine use of strong antiseptic mouthwashes should be avoided unless specifically indicated, as they can disrupt beneficial bacteria. Step 6. Controlled dietary pattern, a critical step. Diet has a direct and immediate impact on the oral microbiome. The most important factor is not just what we eat, but how frequently we eat. Frequent snacking keeps the oral environment in a constantly acidic state, favoring harmful bacteria. Therefore, avoid continuous grazing. Maintain gaps between meals. Reduce intake of refined sugars, sticky processed foods. Include fibrous foods, which help mechanically clean teeth. Leafy greens, which support beneficial bacteria and nitric oxide production. This step connects oral health with metabolic health. Step 7. Support the beneficial microbiome. The goal is not to eliminate bacteria, but to maintain balance. This can be supported by consuming natural foods rich in polyphenols, such as green tea, cloves, and certain herbs, including nitrate-rich vegetables like leafy greens. Avoid excessive sterilization of the mouth. The microbiome needs to be balanced, not eradicated. Step 8. Avoid harmful practices. Certain habits significantly damage oral health and microbiome balance. These include overuse of antiseptic mouthwashes, smoking or tobacco use, excessive alcohol consumption, aggressive brushing. These practices either damage tissues or disrupt microbial balance, promoting dysbiosis and inflammation. Step 9. Use antibiotics and antiseptics judiciously. This is a critical clinical and public health message. Avoid self-medication with antibiotics. Using antibiotics for viral illnesses like sore throat. Unnecessary prolonged use of antiseptic mouthwashes. Most sore throats are self-limiting and can be managed with supportive care such as warm saline gargling. Unnecessary antibiotic use leads to microbiome disruption, antibiotic resistance, long-term health consequences. This step requires both patient awareness and physician responsibility. Step 10. Periodic professional dental care. Even with good home care, periodic evaluation is important. A dental checkup every 6 to 12 months helps. Detect early disease, remove plaque and tartar, prevent progression. Professional cleaning, when needed, supports long-term oral health. Step 11. Make oral care a daily health practice. The most important point is consistency. Oral care is not a one-time intervention. It is a daily practice performed multiple times a day, continuously influencing microbiome balance, inflammation, systemic health. Fluoride are not without any health hazards. Fluoride in toothpaste is not a necessity for every individual. If the oral hygiene ecosystem is well maintained, the body can sustain health without it. Final integration. Let me conclude with a simple but powerful message. Healthcare does not begin in the hospital. It begins with daily habits. And one of the most important of these is oral care. When we maintain the oral environment, we reduce inflammation, we support the microbiome, we protect multiple systems of the body, and when we ignore it, we allow a silent source of disease to persist. Closing statement. The mouth is not just the beginning of the digestive system, it is the beginning of health or disease. Founder, Holistic Wellness Foundation. Imphal. Healing beyond boundaries.